college. Thank you so much.
Thank you, Dr. Ullas.
Yes, ma'am. Thank you. Thank you.
So next I invite Dr. Nidhi R B for the paper presentation. I invite Dr. Nidhi.
Namaste, ma'am.
Namaste, doctor.
Yeah, I'll just present my. Okay, is it visible?
Yes, Dr. Visible.
Good evening, one and all, respected panel and my fellow presenters. I am Dr. Nidhi R B, postgraduate scholar of Department of Shalakya Tantra from Sri Dharmasthala Manjunatheshwar College of Ayurveda and Hospital, Hassan. I am guided by Dr. Gururaj Anilbhat. Today, I'll be presenting an insight on Netrakriyakalpas. Background: Shalakya Tantra is one among 8 specialties of Ashtanga Ayurveda which deals with the diseases occurring above the clavicle, that is, Jatrurdhvaga. It mainly deals with the sense organs, diseases affecting them, and their management. In Ayurvedic Samhitas, the local treatment procedures of Netra are explained in the name of Netrakriyakalpas. Kriyakalpa. Kriyakalpa is the main therapeutic process for ophthalmology in Shalakya Tantra, as the Panchakarma is the base of Kaya Chikitsa. The word Kriyakalpa is composed of two words, Kriya and Kalpa. According to Acharya Dalhana, he opines that Kriyanam Tarpanaputakadinam Kalpanam Karanam iti Kriyakalpaha, which means Kriya means therapeutic procedures for chikitsa used to cure the disease, and Kalpa, which means practicable or possible or manner of acting or a prescribed rule. So, Kriya Kalpa means specific formulation used for therapy in Ayurvedic ophthalmology. Kriyakalpa procedures helps in prevention as well as alleviating the disorders of the eye. It includes selection of specific procedure, preparation of special drug form, and its proper application to the eyes. Ayurveda classics includes many of the topical treatments along with systemic ones in the management of ophthalmic diseases. The reason might be that the drugs administered systematically may not cross the blood aqueous or the blood vitreous and the blood retinal barriers. Kriyakalpa procedures, when adopted, follow the protocol of Purva Karma, Pradhana Karma, and Pashchat Karma. Purva Karma mainly includes the Panchakarma procedures to remove the vitiated dosha from the body, following which the selected Kriyakalpas then administered to remove any remaining dosha as Bahya Parimarjana Chikitsa. Pradhana Karma is the actual type of Kriyakalpa administered. Paschat Karma includes the rules and regulations to be followed after the procedure, example dietary regimen or daily regimen. Kriyakalpa in general. Kriyakalpa room should have proper ventilation but devoid of excessively blowing wind, sun rays or dust. There should be curtains of dark colors like blue or yellow. It should be equipped with materials and medicaments for treatment and to manage complications like Mithya Yoga, Ati Yoga or Hina Yoga. Now, the classification of Kriyakalpa. According to Acharya Charaka, it is of three types, that is Vedalaka, Ashotana, and Anjana. According to Acharya Sushruta, it is Seka, Ashotana, Anjana, Tarpana, and Putapaka. According to Acharya Sharangadhara, it is Seka, Ashotana, Anjana, Tarpana, Putapaka, Pindi, and Vedalaka. Here we can see the general way of practicing the Netra Kriyakalpa. First is the Seka, wherein the medicated liquid or kashayas are poured from a height of 4 angular length. It is poured into a continuous stream. Second one is the Ashotana, wherein the medicaments or the prepared Aushadhi Dravyas are instilled into the eyes from a height of 2 angula. Next is the Vidalaka, wherein the paste of the herbal drugs or the Aushadha Dravyas are applied over the eyelids. And next is the Anjana, wherein it is applied to on the lower punctum, wherein all the herbal medicaments are suggested based on the dosha pradhanatva and to relieve the rogi from the presenting symptoms. Next is the Tarpana. Here it is a strenuous and the most effective Kriyakalpa intended to all the eye disorders. Second is the Putapaka, wherein it follows the same rules and regulations dedicated to Tarpana, where the only difference is the Aushadhis which we are using for the entire procedure. Next is the Pindi. Pindi is the application of type of cold fermentation, wherein we give a mixture of Guduchi and Kumari and keep it on the closed eyes. Here, the selection of therapies. Selection of the therapies is the main factor wherein the drug and the therapy which are intended to a particular disease plays a main role in achieving a clinical success. The selection of Kriyakalpas based on the ocular inflammatory statuses vary on the presenting symptom of the patient. As in, if it is an inflammatory condition, then Seka Ashrotana Pindi Vidalaka would be much more beneficial. And if it is non-inflammatory conditions, then we can go towards the streamers, that is Tarpana, Putapaka, and Anjana Vidhis. Based on the eye segments, if it is restricted to the anterior segment, then the therapies including Ashrotana, Tarpana, Putapaka, and Anjana would be much more beneficial. And if it is restricted to posterior segment, then Tarpana, Putapaka, Anjana, and Nasyakarma would be beneficial. Depending on the anatomical seat, that is the restriction of the diseases towards the anatomical localization of the diseases. Here, if it is restricted to the surface, lesions, or adnexa, then Tarpana, Putapaka, Seka, Ashrotana, Anjana, Pindi, Vidalaka would benefit the patient. If it is restricted to lens, ciliary body, or iris, then we can go for Tarpana, Ashrotana, and Anjana karmas. If much more strenuous efforts are required, which is limiting to retina or optic nerve, then Tarpana, Putapaka, Anjana, and internal medications along with Nasya Karma would be beneficial for the patient. And if it is affecting the visual pathway, then Tarpana, Putapaka, Anjana, internal medications along with Nasya therapy would be beneficial to the patient. The pharmacological action. The Depending on the Netrakriyakalpa intended in the patient depends on the duration of the treatment given to the patient and at to what extent the patient is able to withdraw all the benefits of the treatment. And it depends on the mode of action of the medicines used and the way the drug is delivered for its metabolism and the way the intended result is achieved. So in Ashrotana, there is direct diffusion of the medicaments. Hence, the advantage would be better compliance and it is commonly used. Disadvantages would be less tissue contact time. In Seka, there is direct diffusion. So the mode of action is much more easier. Advantages is remove surface pathogens. Disadvantages, drug excretion more less and bioavailability. Third is the Pindi. Here, transcutaneous drug absorption takes place and the pressure effect. Example, in patients of glaucoma, Pindi has got a much more good result where it will help in reducing the IOP. Advantages, better compliance and more tissue contact time. Disadvantage, there are transient effect which requires repetition and long-term use. Next is the Vidalaka. Here also, the mode of action would be transcutaneous drug absorption. Advantages, better compliance and more tissue contact time. Disadvantage in this case is mostly it is limited to lids, adnexa and anterior segment eye disorders. Tarpana, mode of action is both precorneal and corneal drug absorption. Both lipid and water-soluble drugs are absorbed easily. Advantages, more tissue contact time, which is effective both in anterior and posterior segment. Disadvantages is the difficulty in follow-up of the patient to undergo the treatment. Next is the Putapaka. Here the mode of action and drug delivery restricts to drug ionization, nanoparticles, better absorption and more bioavailability. Advantage, more tissue contact time, effective both in anterior and posterior segment. Disadvantages is very complicated and more complications might occur if at all the Putapaka Aushadhi Dravyas are not prepared appropriately. Anjana, mode of drug action and drug delivery is solid drug delivery, both conjunctival and scleral tissues are benefited from this. Advantages is same, more tissue contact time and effective in both the anterior and posterior segment. Disadvantages is patient compliance less because it is an intense type of therapy wherein the medicaments are still inside the eye. So patients sometimes fail to come up for follow-up or they discontinue after 2 or 3 sittings. Next, why we need to choose Kriyakalpa? Kriyakalpa is the only manner wherein we can overcome the blood aqueous barrier and blood retinal barrier, wherein the absorption and the intended result required to achieve the disease relief of the symptoms of the disease is much more easier when we are intending through Netrakriyakalpas. Here, less doses are required for optimum therapeutic effect, and like skin, structures of eye are exposed to outer environment. Thus, to clean or cleanse, remove surface pathogens, topical therapies are essential. And for diseases of lid and lacrimal apparatus, it is much more beneficial. There is no biodegradation of drugs, and it is the most cost effective and non surgical approach towards treating a disease, which is restricted to eye. And it can be used as preventive as well as curative mode of therapy. Here are the list of common drugs or formulations used in Ashwatthana or Seka. If it is bacterial or viral conjunctivitis, then the combination of Triphala, Lodhra, Yashti, Madhu, Musta, Kvata can be adopted. If it is allergic conjunctivitis, Haridra, Daru, Haridra, Yashti, Madhu, Sirisha can be used. If it is VKC, then we can use Shigru Patra Swarasa in the form of Seka or Ashwatthana to treat the disease. And if it is dry eye disease, then Kshira, Haridra, Daru Haridra, and Saidhava Lavana combination can be used. If at all there are any ocular injuries, then Stanya is the most appreciated medicament which will help in curing the disorder. If there are corneal opacities, then Amla, Nimba, Kapitta Patra, Yashti Madhu, Lodra, Khadira, and Tilakwata can be adopted in the form of Seka or Ashwatthana. If in cases of cataract, then Trifalakavata is the most adopted combination. If there is case of pterygium, then Karanja Bija and Kshira can be adopted. If it is Pothaki, then Khadira, Shigru, Adhaki can be used. Common drugs or formulations used in the form of Pindi. We can use combination of Eranda Patra, Mula, Amla or Mahanimba, Shigru, Trifala. Or we can use a combination of Guduchi and Kumari as well. It is indicated in cases of conjunctivitis, glaucoma, inflammatory conditions of the eye. Drugs or formulations used in Pindi, Manjishta, Chandana, Sariva, Saindava Lavana, Rasanjana, Yashti Madhu, Daru Haridra. Indications: mild inflammatory conditions of the eye, Taruna Netra Roga, Ashrusrava, Toda Kandu, Shotha, Sty, blepharitis, lid abscesses, and trichiasis. Drugs or formulations used in Tarpana, it is an intense mode of treatment, so very careful consideration and practice is required. Here, medicated Ghrita are used. It is indicated in variety of ocular disorders such as Jihyata or Jimhanidra, Tamyata, Rukshata, Adhimanta, and in cases of ARMD, optic atrophy, and degenerative disorders of retina, Jivantyadigrata Tarpana can be administered. In cases of uveitis, Patoladigrata. In cases of diabetic retinopathy or non-proliferative diabetic retinopathy, Durvyadagrata is much more beneficial. In cases of senile cataract or refractive disorders or RP, Mahatrifalagrata is much more beneficial. In refractive disorders and the most commonly used in myopic conditions, Trifalagrata is much more beneficial. In cases of corneal opacity, Tiktakagrata is much more useful. Drugs or formulations used in Puttapaka, plant drugs or animal flesh or mineral drugs and fats. In cases of RP, Pipalyadi Puttapaka is useful. And in cases of corneal opacity, Lekhana line of administration is required, wherein we can use Krishnadi Puttapaka. The formulations used in Anjana, it is of 3 types, that is Gutika, Rasikriya, and Churna. The drugs used are compound drugs prepared of metals, minerals, and herbs. Generally, antimony, lead, and tin compounds are frequently prescribed. Here, in Naktandya cases, combination of Maricha, Dahi Anjana and Pippaladi Anjana is beneficial. In Arma, Chandrodyavarti Anjana is commonly practiced. Gudichi Rasakriya Anjana, it is used in vascular disorders of retina, optic nerve diseases, etc. Chandraprabhavarti Anjana, it is used in degenerative conditions of conjunctiva, pingicula, etc. Take home message would be Netrakriyakalpa is the most non-invasive and non-surgical approach in treating the eye disorders much effectively. Secondly, it is cost effective, so it is feasible, and most of the middle class, upper class, or even lower class can uh, go through the treatment and benefit in treating the eye disorders. It can be practiced for both preventive and curative aspects, and it is effective in both the anterior and posterior segment disorders. A gist of it, Chakshurakshayanam Sarvakalam Manushyer Yatnaha Kartavyo Jivite Yavadicha Vyartho Loko Ayam Tulya Ratri Divanam Pumsam Andhanam Vidyamane Api Vitte. It says that all effort should be made by men to protect the eyes throughout the life. For the man who is blind, this world is useless. The day and night are same, even though he may have wealth. So, protecting the eyes is the first most procedure or duty of everyone to protect their eyes so that he can enjoy his life, see the world without being affected by any disorders. Thank you.
Thank you, doctor. Next, I invite Dr. Vashishth Gohel. I invite Dr. Vashishth.
Yes, ma'am. Am I audible?
Yes, doctor, you're audible.
Yes, ma'am. I'm sharing the screen. Is it visible?
Your screen is visible, doctor.
Yes, doctor.
Your screen is visible. Please start the session, doctor.
So good evening, everyone. Myself is Dr. Vashishth Gohel. I'm the PG scholar of Department of Comparative.
Doctor,
so today my topic is...
Doctor, please put it in presentation mode.
Yeah, sure. Just a minute. Okay?
Yes, doctor. Please continue.
Yes. So today the topic of presentation is Sharpunkhadi granules as a palliative care thalassemia. So going to this case, I'll brief you about what is thalassemia. So as we know that the thalassemia is a genetic disorder. So it is a disorder of globin chain production. So there will be two type of thalassemia, that is beta thalassemia and alpha thalassemia. So in thalassemia, there will be complete absence or partial reduction of beta globin gene is present, due to which the pathophysiology is formed like two major features are presented by the thalassemia syndrome, which is inadequate beta globin gene production, which causes decreased level of normal hemoglobin, that is HbA, which is known as hemoglobin adult. And second one is imbalance of alpha and beta globin production. So this will cause, in other hand, as we know that the red blood cells are produced from the bone marrow, in thalassemic patients, the bone marrow mutation is disrupted. The RBC mutation is disrupted, which causes maturation of RBC that causes ineffective erythropoiesis. While there will be bone marrow hyperactivity is present, but the patient develop few reticulocytes and severe anemic condition due to this beta globin gene present. So now I'll come towards the beta thalassemia. In beta thalassemia, there will be more alpha globin gene is present rather than beta globin gene. So this alpha globin gene is responsible for the tetramer formation, alpha tetramers formation, which does the interaction with red blood cells membrane, which due to this interaction, the RBC membrane loses its survival that causes reduced cell survival, due to which the anemic condition and erythropoietic production is induced. While there will be more production of gamma and alpha. So meanwhile, the gamma production is increased in amount rather than beta. So this gamma elevates the HbF, that is hemoglobin fetus. And on other hand, in alpha thalassemia, there are few alpha globin gene were present rather than beta globin gene. So this beta globin gene forms Bart's hemoglobin, which is in fetal life, present in fetal life. And in other hand, after the birth, after the delivery, there will be presence of HbH. This is also known as Bart's hemoglobin. So these are not as lethal as beta, but it can lead to vascular hemolysis production. So where there is a difference in alpha and beta, where there alpha thalassemia is seen in prenatal, which causes alpha fetus, it may be symptomatic due to HbF required insufficient. There will be HbF requirement due to insufficiency of alpha gene. Whereas in beta, that is postnatal. In postnatal state, the beta infant is born, which produces symptomatic effects, due to which HbA requires. It means that alpha, that is postnatal period, there will be more requirement of beta gene, that is beta infants, which this beta is acquired from HbA, which is required inadequate, but there will be no production of beta gene. So by going this brief introduction, I'm moving to the case summary. So there is a diagnosed case of thalassemia, that is thalassemia major, that is beta thalassemia, was managed at OPD level with the administration of Sharpunkhadi granules as palliative care along with ongoing allopathic medicines, which shows significant improvement in patients' quality of life. As we know that we cannot treat this disease, we can only manage this disease. So by managing this disease, we have come across how to build up the quality of life of the patient. So in patient description, so there is a 7-year-old female patient who is diagnosed case at the age of 1 year. She arrived at our hospital with complaining of excessive tiredness, anorexia, pale color skin, weight loss, face bone deformity, abdominal swelling with discomfort and generalized weakness. She was already receiving allopathic treatment along with blood transfusion every month from the same condition. She is on blood transfusion since more than 8 months. So the complaints was excessive tiredness since 1 month, anorexia since 1 month, generalized weakness, and weight loss. The baseline finding were there will be more pallor and ectus was present. There will be no any edema was present. Lymphadenopathies was there. Hepatomegaly was there. That is 2-finger hepatomegaly was there. And splenomegaly was highly significant. At that time, when the patient arrived at our hospital, her WHO QOL parameters is given in this. There is general assessment, physical, psychological, social assessment, and environmental assessment. This assessment has been made under the WHO QOL parameters, that is quality of life parameters given by World Health Organization. So at the time of first, there will be investigations includes this, that is HB is 6.5, HbF is 1%, HbA is 89.70%. RBC, WBC, MCV, MCH are significantly lower than usual. Platelets counts were highly high at the time of first preference. The history is like before the age of 1 year, the patient appeared to be healthy and normal. Suddenly, a parent find delayed growth and development with severe drop of blood count and severe anemia. For that, they consulted a pediatrician nearby and underwent some tests where they find out the thalassemia major check. Actually, at this time, the parents was not also aware about their condition. Actually, they are carrier for the thalassemia disease, but they are not aware about their conditions. So they planned their pregnancy and delivered positive child. Diagnosis is a known case of thalassemia major, that is beta thalassemia. We have planned Sharpunkhadi granules for 3 months. So, which includes Sarpunkha, Guruchi, Amalki, Punanava, Ikshu, Gobrut, and Sita, which has been given in lukewarm water for morning and evening, 2.5 gram, without taking any food. That is empty stomach. So, after 1 month finding, we have significantly reduced the pallor and ictus. Their ictus was not present at all, but the pallor was present. There is reduced edema, lymphadenopathies, hepatomegaly and splenomegaly was still there, because we know that this this condition is very severe to attend completely or cure it completely or manage it completely. So, but after 1 month, there will be highly significant changes seen in WHO QL parameters. After the 3 months, we have come across drastic changes in pallor, ictus, and edema. There will be no hepatomegaly was present, but splenomegaly is still there. But in the parallel head, we have seen highly significant changes in WHO QL parameters. This shows that we haven't found our, our efficacy of medicine in clinical parameters or significant parameters more rather than QL parameters. So we have come across this patient after yesterday only. She came to me and I have taken a follow-up of her. She underwent in blood transfusion last week only. At that time, the blood during blood transfusion, her HP was 6.6, which is reduced. The HP was reduced previously. I specifically quoted that the HB is reduced from previous findings. Like previous finding, her HB was 7 or 7.1 around, but at this time, the HB concentration is reduced to 6.6. We are finding the cause, because why this HB percentage is going down, even though her clinical significance and clinical parameters are highly significant. But after thoroughly examination, we have found across that her blood transfusion gap, that is, she is usually doing her blood transfusion every 1 month, specifically 30 days. But in this time, in this scenario, the blood transfusion is taken more time. That is, we have asked her to see what time she is undergone for blood transfusion. At this time, she has taken after 40 days of first breast transfusion. That is last BT. So where she was doing her BT in every 30 days. In this case, after 3 months of complete medication, her blood transfusion time is increased to 40 days. Even though HB percentage is low, but the gap of the BT is increased. So this shows a significant effect for us, because this shows that this medicine is work as we are planning to work at this. So these are the investigation of last follow. So now the comparison is on the day first, the QL score was 44/85, with HbF is 1% and HbA is 89.70%. After 3 months of the treatment, the QL score was significantly changed from 44 to 58, where there is mild changes in hemoglobin and blood transfusion. Continue, yes.
Hello, doctor.
Yes.
Doctor, your time is up. Can you please speed up your presentation?
Yes, yes, ma'am. Yes. So the conclusion is After the administration of Sharpunkhadi granule, there were no significant changes in hematological electrophoresis changes, but it shows the highly significant changes in quality of life of thalassemic patient. Thank you.
Thank you, doctor. So next I invite Dr. Supriya Vijayrao. I invite Dr. Supriya. Dr. Supriya. So next I invite Dr. Sneha. I invite Dr. Sneha Vidate.
Yes, ma'am, I'm here. Hello.
Good evening, doctor. You're audible.
I'm audible. Can you please share my paper?
Okay, Dr. Sneha, I will share for you.
Yes, sir. Thank you.
Just a moment, Dr. Sneha.
And before that, dear participants, please try to finish your presentation within the time limit. Thank you.
Dr. Sneha, please start the session, doctor.
Yes, sir. PPT, huh? Yes, sir. Good evening to all. My topic is evaluation of Sharkara as an anupan on the bioavailability enhancer effect of Haritaki, a study protocol. Myself, Dr. Sneha Vidate, Assistant Professor, Department of Dravyagun, Mahatma Gandhi Ayurveda College. Introduction. Anupan is defined as a vehicle with which the medicine is taken. In treatment of Ayurveda, medicines are prescribed to be taken with the various anupanas like adjuvant, like warm water, honey, ghee, milk, etc. It is said that to increase the potency of drug administered in the body carries essential element to target drug delivery system and also improve the palatability. Next, sir. Hello. Bioavailability. That bioavailability refer to the extent a substance or a drug become the completely available to its intended biological destination. Bioavailability is a measure of the rate and fraction of the initial dose of drug that successfully reaches the either the site of action or the bodily fluid domain from which the drug's intended target have unimpeded access. Next, sir. So many drugs as a bioavailability enhancer are used in the Ayurveda in the form of anupan, like Haritakya is going to be Rutu Haritakya is mentioned in the Ayurveda. So based on this concept of Yoga Vahi, since the time immemorial, therefore it can be said that this concept of bioavailability enhancer already exists in Ayurveda. The uses of Ayurvedic preparations recur to especially during the period of between the 7th century BC and the 6th century AD provided more weightage to the practice of bioenhancing. For the first time, it was reported by Bose in 1929, who described the increase in anti-asthmatic effect of Vasaka, that is Idathoda vasica leaf by addition of pipali, that is Piper longum, to it enhance the bioavailability. Next, sir. So there are Rutu Haritaki is mentioned in the Ayurveda, which having given a different anupanas in a different rutus. Haritaki or terminal chevula is held in a high esteem in Ayurveda for its properties to prevent and cure the diseases. It is also called as a king of medicine because of its extraordinary therapeutic benefits. Haritaki has all the rasas except the lavan. It also having a rasayana property, and it is only drugs which is prescribed with a different anupana in a different rutu as given in table, so that they can increase. It can increase the bioavailability as per their the rutu. Next, sir. So my research question is that whether the assessment of bioavailability of Haritaki with Sharkara as an anupan in Sharad Rutu, whether it increase or enhance the bioavailability or not. Next, sir. My hypothesis is bioavailability of Haritaki may be enhanced with Sharkara as an anupan, and null hypothesis is bioavailability of Haritaki may not be enhanced with the Sharkara as an anupan. Next, sir. Aim, evaluation of Sharkara as an anupan in the Sharad Rutu on the bioavailability of Haritaki. Next, sir. Next, these are my primary objectives, that evaluation of bioavailability of Haritaki with Sharkara as an Anupan in Sharad Ritu, evaluation of bioavailability of Haritaki without Sharkara as an Anupan in Sharad Ritu, and to compare the both. Next, these are my secondary objectives, that to assess the characterize and phytoconstituent of Haritaki, to assess and characterize the phytoconstituent of Haritaki with Sharkara, and to compare the phytoconstituent of Haritaki in about 2 groups. Next, sir. This is my study work plan. First, we have to procure the Haritaki, then authentication from the FRLST, drug standardization quantitative analysis by HPLC method to the blood plasma, screening of investigation and collection of 2 ml blood sample of healthy volunteer and transfer to the EDTA tubes. Then it will be centrifugation at 12 to 16 RPM for 10 to 12 minutes. Evaluate bioavailability enhancer effect of Haritaki with or without Anupan. After getting the plasma, we have evaluated the whatever the bioavailability is getting in the Haritaki, whether it is Chebulin, Chebulagic, Myricin, Galangin, these we will evaluate. Next, sir. This is my materials methods, that is the Haritaki is procured from the reliable sources, Anupan, that is Sharkara. We have taken a healthy volunteer from the OPD of Mahatma Gandhi Ayurveda College Research Center. Next, sir. A study design, this is experimental study, randomized controlled trial. We have 3 years duration for this, and place of research studies, MGS and RC. Next, sir. This is the sample size calculation according to the Bhupati Vaja, that is the power of 85% will be reasonable for the bioavailability study to conduct on healthy volunteer by considering the value of lower bond at 0.80, upper bond 1.25, alpha 0.05, geomean ratio, that is JMR 0.947, coefficient of variation 0.239 as fixed. The sample size can be calculated as below according to the Bhupati. Next. So this is the sampling size and group, that group A and group B. Group A considered as a 30 healthy volunteer and group B is 30. So in mid-September to December, up to the mid-December, we have to collect the 2 ml blood sample of every half of an hour. Next, sir. Inclusion, this is firstly we have to screening parameters, CBC, LFT, KFT, RBS and lipid profile we will done. Then inclusion criteria, that volunteers of age group between 20 to 40 year, blood report within the normal limit, lipid profile within the normal values, liver function test with the normal values, renal function test with the normal values, and no history of major illness and hypertension, and BMI index should be 18.5 to 24.9. These are the inclusion criteria. Next, sir. This is the inclusion exclusion criteria, that volunteer with any medications or any acute or chronic disease will be excluded. History of drug or alcohol abuse, liver, kidney disorder, hypertension, diabetes, BMI index less than 18.5 and more than 24.9. Any other systematic disorders will be excluded. Next, sir. This is the method with the justification. The whole methodology is divided into 4 parts, that is drug collection and standardization, screening investigation, collection of blood sample, assessment for the bioavailability, enhancer effect. Next, sir. Drug collection, that is the Haritaki from the authentic source, and Anupan, that is Sharkara, will be procured. Next, sir. This is standardization and that will be performed, that is the pharmacological studies, microscopic studies, macroscopic study, powder microscopy, physicochemical studies, that is foreign matter, moisture content, ash value determination, extractive value determination, and pH value, HPLC. Next, sir. This is screening investigation that I already mentioned. Next, sir. This is the collection of blood sample, that Anupan should be taken as a Sharkara, half pulp, as per the AFI, with 96 ml of Haritaki Kvat with the empty stomach. Period of intervention is, we have to given the sample Kvat to the healthier volunteers, that is empty stomach, early morning. 2 ml, after that 2 ml blood will be collected 30 minutes after giving the Haritaki Kvat with and without Anupan, and transferred to the EDTA bulb. Centrifugation will be done. The uppermost supranunt liquid will be extracted. 1 ml store supernatant will be mixed with the 2 ml normal saline, and then it will be filtered to get clear solution. After that, it will be injected to the HPLC column. Next, sir. These are my grouping that blood collection time in a minute after the administration of drug. We have to collect blood so initially. After that, we have to again collect the blood at 30 minutes, 60 minutes, 90 minutes, 120 minutes, 180 minutes, 240 and 300 and 360. All this drug administration or after drug administration, we have to collect the blood sample and doing its HPLC. Next, sir. This is the assessment of bioavailability enhancer effect with the anupan and sharkara. Cebulinic acids, ascorbic acid and phenolic compound will be assessed with the HPLC method. HPLC separations will be carried out for the decoction of dry fruit of terminal cebula. Along with its bioenhancer will be compared with the plasma separated from the selected healthy volunteer to evaluate the presence of active metabolites. Next, sir. This is my conclusion and discussion. While treating the disease, anupan play an important role in the treatment. Anupan is complementary substance taken afterward along with the principal drug. Maybe it enhance the absorptions, actions, therapeutic effect of the principal drug. Certain drug may be act specifically and effectively when administered with the specific anupana. In a present study, we will discuss regarding the increase of bioavailability of haritaki with and without sharkara as mentioned in Rutu haritaki. Next, sir. So these are my references. Thank you so much.
Thank you, doctor. Thank you for this wonderful presentation.
Thank you, ma'am.
Thank you, doctor.
Yes. So next I would like to invite Dr. Mayuri Deshpande. I invite Dr. Mayuri Deshpande.
Yes, ma'am, I am here. Is the screen visible, ma'am?
Yes, doctor.
Visible.
Yes. My name is Dr. Mayuri Deshpande, and today's my topic of presentation is quick result of Agnikarma in patient having Pakshaghat with slurred speech and dementia through Ayurveda. Here is the introduction. Vyadhi, Vatajnanatmaj Mahavatvyadhi, Vatajnat is a Pakshaghat. Pakshaghat has been connected to hemiplegia, a form of paralysis brought on by the stroke or CVA. The phrase is Paksha Dehangasya Ghatam, Vinashanam Yasmat Yatrava. The following synonyms for Paksha are expected, but the suffixes such as Aghata, Ghata, and Vadha are different. While Ghata, Aghata, and Vadha are terms for killing, devastation, and paralysis, respectively. Paksha refers to a man's flank or side. Vata is regarded in Sharira as in charge of all the three doshas. Vatvyadhi is the result of vitiated Vata's influence on the doshas, which permeates the whole body or a portion of it and result in variety of diseases. Hemiplegia is also known as Pakshaghat. In this case report, we have a patient of recurrent stroke in last 2 years. He had taken many medication from last 2 years. In this case, we got best result in less time period. A 65-year-old man come to the OPD of MGSC and RC Vardha with loss of muscle power of right side limbs of the patient body, slurred speech and dementia of vascular origin. All these symptoms are present in the patient from 2 years. Hiccups were started from 15 days and no relief from conventional medicine. Family history, sibling, no significant history found. Past history, patient had first stroke 2 years back. History of HTN, history of recurrent strokes. Personal history, diet, non-vegetarian and vegetarian food, stale food, chivda, wafers, farsan are taken occasionally. Patient don't follow timing of eating. Habits, chewing tobacco and taking alcohol. Sleep was disturbed, bowel was not satisfactory and malabadhata was there. Patient was apparently good before 2 years. Then he got first stroke. Then up to this time, he had three strokes in between. He was having continuous hiccup. Patient was alcoholic, as I told earlier. Ashtavavid Pariksha, Mutra, Shabda, Sparsha, and Grika. were normal. Nadi 64 per minute, Sarpagati was felt, Mala 3 to 4 times and unsatisfactory, and Malabaddhata was there. Then Jiva Sama. Here Akruti Madhyam Dosh Vata and Pitta Dusha Rasarakta Asti Strotas Rasavaha Raktava Astiva Strotas Sangha was there, Roga Marga was Madhyam, Agni Mandagni Udbastan Pakvashay Adhishtan Rasa Rakta Asti Vyaktistan, right side of the body, Jiva and Murdha. Here is the diagnostic assessment, muscle power, right upper limb and lower limb 2, and on MMST scale, which is taken for dementia, is 18. Here is a treatment plan. Vijayrao was done 2 times a day on Stapani, Avarta, Apanga and Jiva Mool for 7 days continuously. Along with this, Yograj Gugul, Ampachapati and Musta Marmakashai was given. Yograj Gugul was given BD before meal and Ampachapati also was given before meal with Poshnajal for 8 days, and Mustavi Marmakashai was given Muhur Muhu as there was hiccup to the patient. Here we have a before and after walking video of the patient. You can see the right side of the patient was not that functional, and 2 of his relative was assisting him for walking. Here we can see the after video. Here you can see the August 7. Only in 3 days, we got such beautiful results. Here is the video for slurred speech before and after. The speech was slurred and not that spashta. The patient is talking in Marathi. Yes, this was the video. Here's the assessment criteria. MMST scale before treatment was 18 and after treatment 30. Then muscle power was 2 and after treatment it was 5. Here is the mode of action of Vijayrao in modern point of view and Ayurvedic point of view. In modern point of view, there is endogenous opioid peptides which gives GABA and which causes analgesia. Norepinephrine inhibit pain and downregulates glutamate, and in all it causes downregulation of CNS. Here we can see the Vata Shaman, Rakta Shodhan and normalizes the Sira and Kandara, and normal movement can be seen. Here is the why Stapni and Avarta, Apanga Jiva Mool is chosen, is given in this slide. Stapni, the both are the Sira Marma and Avarta was Sandhi Asti Marma. The frontal lobe is situated just behind the Avarta, so for the stimulation it was taken, and as we know the Sira and Sira Marma, Stapni and Apang. So for the beneficiary for the Pakshagat, it was chosen. Here is the Jiva Mool for slurred speech, which causes the detoxification from the Visravan of Rakta. And here is the Pathya Apatya, which was advised to the patient. Here we can see the discussion Vidyakarma is done as per sites given in Sushrut by the RB Gopte sir's technique. Ampachakvati was given for the enhancement of Agni and Yogaraj Bubru was given for the Vata component. Here we have the conclusion. Vidyakarma is a magical technique. In this patient, we got best result in drastic manner. It is cost effective and minimal invasive procedure. Here we have the references. Here we have take home message. Ayurveda can tackle with any disease, just you have to hold your approach. Thank you.
Thank you, doctor.
Thank you, doctor. Thank you for the wonderful session.
So next I invite Dr. K.
Next, I invite
Dr. K. Ganga.
Vani K.
I'm not audible. Am I audible now?
Yes, doctor,
doctor,
you're audible.
you're audible.
Yeah. Give me a second.
Your screen is visible, doctor. Please start the session.
Good evening, delegates. I'm Dr. Ganga Bhavani, final year PG scholar, Department of Dravya Guna, NRS Government Ayurvedic College, Andhra Pradesh, Vijayawada. My topic is Dravya Guna Importance from Cultivation to Application, which is guided by Dr. Madhusudan Rao, sir, Associate Professor from the same college. More than 90% of the formulations under the Indian system of medicine, that is Ayush system, predominantly contain plant-based raw materials. Here, the efficacy of these systems mainly depends upon the use of genuine raw material of quality and standard ingredients in the manufacture. For centuries, the forests have been the source of herbs. In the last few decades, while the availability of medicinal plants collected from forest is becoming uncertain, demand for herbs has been increasing due to resurgence in the interest in Ayush systems. Therefore, the forest resources are under the double pressure and are not able to meet the demand. A number of species have been rendered vulnerable to extinction due to the lack of cultivation and also due to unsustainable collection of these plants from forests. Here we know, considering the above situations, we should take care of the measures to promote the cultivation of medicinal plants and create awareness amongst the people, particularly among the farmers, about the medicinal values, medicinal plants and the economic value of these plants. As already mentioned, our Acharya Charaka, Anenopadesena, Nanoshadi Putam, Jagat Kinchit, Dravyam Upalabhyate, Tam Tam Yuktamardam Cha, Tam Tam Abhipretya. According to our knowledge, we can use the herbs. Here, there are no worthless herbs, only the lack of knowledge. So, physician have to take care of Dravya Bhuta Yukti Vyapasriya Chikitsa. Here, Dravya Guna stood like a backbone of Ayurveda, so we should take care of the drugs. Dravya Guna is a science of properties and actions, and they tracks the impact and the action of the drugs prescribed for the ailments. And here it is the raw material manufacture and the effect of the drug in the healing journey is carried out by the acharyas. This branch deals with the identification, collection, storage, and the preservation of the raw materials of the plant origin. As Ayurveda modernizes, there's an effect to search for the best, safest, and the most effective treatment. Here, the herbs are utilized by the human world as food, insect repellents, as animal drugs and food, as a herbicides, and these herbs can be used as a needs of primary health things. And nowadays, people are seeking for the herbs for the cosmetics too. Why Dravya Guna is important? It provides the adequate knowledge about the identification of the plants, understanding the growth of various plants and trees, development of the repositories and the gardens, and providing the quality knowledge regarding the herbs, developing the digital herbarium for the cultivation sector, which is helpful a lot, enriching the knowledge of resource management. What is the need here? Medicinal plants have so far been collected from wild resources. However, the plant material collected from the sources is replete with the problems of adulteration and the misidentification. The wild varieties also differ with the presence of active constituents from the area to area. In view of these, we should consider the cultivation of the genuine, authentic variety of plants may be the only way to have the raw material of required quality. However, the cultivation of these plants has never been easy and commercially viable. Non-availability of the proper techniques, soil, and the authentic plantation material are also some of the main constraints. Materials and methods here, I took internet-assisted literature carried out by Google Scholar and PubMed, and some scientific journals and articles published also I took for this reference. Cultivation of the medicinal plants offers opportunity for crop diversification and the income generation to the farmers. Here, the development of the sound agro-technique for the plants that has been a major challenge in promoting the cultivation. Here, the cultivation to harvest, we are inculcating the technique, intercropping technique. This intercropping is the cultivation of 2 or more plants at the same place at the same time. Careful planning is required when selecting the component crops, considering the environmental conditions. Intercropping with phytoremediation design, which leads to reduction in the heavy metal contamination in plants. The significance here, it leads, increases productivity, minimizes the risk, reduces weed competition, and stabilizes the yield. It improves the soil fertility and conservation. At last, it's more important thing, the prevention of heavy metal accumulation in plants. Here, these results the good quality herbs for the human world to consume. And this results in the main medicinal crop for good quality with acceptable level of the traceable metals. It also helps in preventing the harmful effects on plants as well as human beings. The role of technological interventions in current scenario and future possibilities are application of scientific knowledge can be helpful in efficient modifications and applications in present situation for dealing with the problems of yield. Without having the proper information of the soil texture, getting the optimum yield is not possible. So first one should take care of the cultivation and measures to control the adulteration and substitution of the genuine drugs. The important elements to be considered are herbal gardens, knowledge on herbs, development of Ayurvedic resources, training of quality control officers by PG and PhD scholars, and to develop quality control and the analytical testing facilities equipped with modern analytical tools. Where the lacuna, we should observe first that problem. Next, develop the solution. Next, try it out and the implementation. We should implement in the field. However, the development of the sound agro technique for the plants that have traditionally been collected from forests has been a major challenge in promoting cultivation as both in situ and ex situ conservation techniques. The WHO has published guidelines for the good agricultural practices for medicinal plants. Here they are. Select proper site for cultivation, proper time and proper variety of the species, land preparation, transplanting the propagating material with optimum space, maintenance practices and irrigation practices, disease and pest control, organic farming, and prune and collection only desired when the mature part without harming the mother part. They do not collect the whole population, leave at least 30 to 40% for regeneration. It helpful in the conservation of flora and fauna. Harvesting. After collection, proper storage to be done to attain the quality of raw materials. In this background, a need was felt to develop agrotechnics for some of the important medicinal plants by involving the R&D institutions and universities in the country. Now, the government sectors are undertaking these projects and doing research works, which are specialized research and development in the institutions of Council of Scientific and Industrial Research, Indian Council of Agricultural Research, Indian Council of Forestry Research and Education, which required infrastructure and expertise to study. So more organizations are required to undertake the experimental cultivation of the selected medicinal plants and are to be executed for certain years and to assess the data. The performance and the progress of the project was monitored by the project evaluation committee, and these could be submitted to the higher authorities from there to public. Conservation of biotechnology plays a major role in preventing the plant species extinction, in maintaining the balance of ecosystem. The fact that medicinal plants could be used as a sources of revenue for farmers. Yes, true, it's true. The Institute of Biodiversity Conservation has initiated the development of a project on conservation and the sustainable use of the medicinal plants. One should follow the steps of standardization raw drug standardization, process standardization, end product standardization, all these achieve the good results in treatment by physician. Their Dravya Guna scholar plays a pivot role in executing the every step from the cultivation to application. I'm going to conclude these as Ayurveda becomes the leading alternative medicines in India. It is important to arm scholars with their innovation thoughts from cultivation to application. Conservation of medicinal plants deals with the controlled utilization and the official supervision in order to protect or preserve them. The goal of conservation is to support sustainable development by protecting and using biological resources in ways that do not diminish the world's variety of genes and species. Promoting cultivation of the medicinal plants through standardized agro technique to yield quality, safety, efficacy raw material with the desired chemical constituents to reach the Ayush market demand. Innovative ideas in Dravya Guna in today's world favors in providing the quality herbs. It helps in conserving the biodiversity of flora and fauna of the ecosystem. Here, these are the reference I took. Thank you.
Thank you, Dr. Ganga, for this wonderful and energetic performance. So next I invite Dr. Sai Pravalika.
Good evening. Can you share my PPT? I cannot share it.
Doctor, please start the session, doctor.
Yeah. A very good evening to one and all. I am Dr. Pravalika. I am present. I am pursuing MD final year in Dravya Guna department. I am from Vijayawada, Dr. NRS Government Ayurveda College. My topic is Apamishrana Dravya. Why I took Apamishrana Dravya in present condition. Next slide, please. In present condition, you can see so many problems regarding health. This is mainly because of what we are eating and what we are taking the medicine. So I took this is the main problem in present era. Adulteration is a process of substituting the original crude drug partially or full with other substances which is either free from or inferior in therapeutic and chemical properties. Adding of low grade or spoiled or spurious drugs or entirely different drug similar to that of the original drug substituted with an intention of an enhancement of profits. Next slide. What are the factors creating in adulteration or spoilage, deterioration, admixture, sophistication, substitution, and inferiority? Next slide. These are the different types of adulteration. One is directly or indirectly, directly or intentional adulteration, because the availability of a drug, if it is less, so that and directly they are involving all these adulterant drugs in medicines or food substances. Indirectly, without knowing, they are mixing adulterant substances. Next slide. Next. Types of direct adulteration: substandard or inferior commercial value by artificially manufactured substances, by exhausted drug, addition of heavy metals, usage of presence of vegetative matter from the same plant, addition of synthetic materials. These are the types of direct adulteration which are involved. Next slide. These are the inferior substandard commercial values where most of the drugs are involved. Maricha, Indian senna, strictness, kupilu, and saffron, belladonna leaves. All these are mostly commonly adulterated. Next slide. Next slide, please. And kupilu is adulterated with Kataka seeds, where looking is similarly, where we can say adulterants are morphological similar and properties are dissimilar. So if you are giving morphologically similar drugs, there are no use. So adulterants can cause many side effects. Next slide. Next. Adulterated with artificially manufactured substances, where we can see mostly food items are adulterated. Artificial invert sugar for honey, beeswax with yellow paraffin, calcium carbonate in place of Vamshalochana, where Vamshalochana and calcium carbonate look similarly, but not in the properties. Properly cut, shaved basswood of nutmeg, Next slide. Beeswax is adulterated with yellow paraffin, first two, and invert sugar. That means very sweetness will be there, but not in properties, where mixes in honey. Next slide. This is the calcium carbonate and vanchalochana. Next slide. Using exhausted drugs, that means where oil is extracted and the same drug is used for medicinal purposes, where there is no volatile principles in that particular drug. Coriander with oil from fruits, cinnamon with oil from leaves, peppermint oil with cornment oil, used tea leaves dried and mixed with genuine drugs. Saffron and red rose petals are dried with reagents. Next slide. These are the examples. Addition of heavy metals, where we can see many side effects like organic failure, like kidney problems and many liver problems because of these pieces of limestone in Asafoetida, lead in pieces of opium, large number of stones with licorice root. Next slide. Next slide. Harmful adulterants are opium with lead shots, cocoa butter with paraffin, argemone seed in mustard seeds, white oil in coconut oil, menthanol yellow in turmeric powder, addition of rodent fecal matter in cardamom seeds, where we are using all these drugs daily uses. Next slide. Adulteration of powders, capsicum with sandal powder, cinnamon with hazelnut shells, maltose phaloppines with Bexa orella. Brick powder is added for barks. Next slide. Foreign materials, Nux vomica powder with olive stone powder, resins with colophony. That is one drug where we can see holes. Gugula is mixed with stone pieces and sand particles. Next slide. Adulterated with vegetative matter. Instead of bala moola, this is for drugs. Instead of bala moola, stem or whole parts of the plants are used. Lichens growing on bark mixed with cinchona. Clove is mixed with leaves and petioles. Next slide, please. Indirectly, geographical sources, growing conditions, processing, storage. While doing all this process, knowingly or unknowingly, adulterants are mixed in drugs. Next slide. Reasons of unintentional adulteration or confusion in vernacular names: lack of knowledge about authentic sources, similarity in morphology, unscientific collections, lack of authentic plant, similarity in color. Next slide. Faulty collection of a crude drug. Seasonal wise, wild cherry bark should be collected only in autumn season. Solanaceous leaves should be collected in summer. Cinnamon bark in rainy season. Other than these seasons, if you are collecting, there will not be any active principles and it can be said as adulteration. Coriander when fully grown and ripen, but we are not doing that when it is in starting stage itself, we are taking from plants. Next slide. Next slide. Improper drying also may lead to adulteration, where digitalis leaves should be dried in shade, but when we are directly keeping in sunlight, where we can miss all the active principles and no use in using. Next slide. Improper storage and maintenance. Volatile oil should be closed in containers and in a dark room. Cod liver oil stored in amber colored bottles. Not maintaining proper labeling or storing conditions and hygienic conditions. Next slide. Evaluation. How can you evaluate adulterants? Identity and purity and quality. These are the three principles. Next slide. Methods to detect adulteration: morphological or organoleptic characteristics, microscopic evaluation, chemical evaluation, biological evaluation, and physical evaluation. Next slide. Organoleptic, like characters, color, odor, taste, size, shape, touch, texture, etc. Next. These are the shapes and colors. I have mentioned some of the examples. wavy shape like Rauwolfia, disc shape of Nux vomica, conical shape aconite, sweet taste of honey and licorice, bitter taste in gentian and chirata, brown color of cinnamon, pungent taste of capsicum and ginger. Next. Microscopic evaluation examples are clove stalk, which contains sclerites and calcium oxalate crystals. But when we are adulterating with some other substances, we can see through microscope absent of these two clove stalk where it contains sclerites and calcium oxalate, we cannot see. And glandular trichome of mint and warty trichome of senna. Next slide. Chemical evaluation through qualitative and quantitative test, saponification, and resin values, glycoside, tannins, etc. Next. Through chemical examinations like alkaloid test, volatile test, and assay of total alkaloid in belladonna herb, chromatography and spectrography method. Examples are TLC, HPTLC, etc. Next slide. Physical evaluation, moisture content and specific gravity, viscosity, melting point, solubility, refractive index. Next slide. Adulterated food, where we can see more nowadays. Adult food is dangerous because it may be toxic and can affect health, and it could deprive nutrients essential for growth and development. Food is declared adulterated if the substance which is added injuriously affects the body, and it is the colored or processed to improve its appearance, or if it contains any added toxic substances. These are the food items with adulterations: honey with sugar syrup, black pepper with papaya seeds, coconut oil with other mineral oils, cumin powder with sawdust, asafoetida with resin or scented gum and colored, sugar with chalk powder, cardamom oil is removed and pots are coated with talcum powder, chili powder also same like cumin powder, sawdust and sawdust, coffee with chicory, coriander with powdered horse dung, cloves, oil may be removed, cumin seeds, grass seeds colored with charcoal dust. Next slide. Next slide. These are the tests conducted in our department. First one is sample of market sample, and second one is dried and powdered our own drug turmeric, and it is a market sample of turmeric raw material where we powdered and we mixed with water, and the color changes are like this. Can you move the slide, back slide? Where the fresh drug without adulterant, we have seen the pure one, where the color is less. Next slide. These are the acts which involved in adulteration: GMP, Food and Drug, Drug and Cosmetic Act, API and AFI, where we can see all the significance of adulteration. We can see in that. Next slide. Criteria of GMP rules and act under the Schedule T for Ayurvedic, Siddha, Unani remaining drugs. Under Section 33 EE, we can consider this GMP Act. If it consists any filthy or decomposed material, if prepared, packed or stored under the unsanitary conditions, if its container contains any poisonous or deleterious substances, color other than the one which is prescribed, harmful or toxic substances, if any substance mixed to reduce its quality and strength. Next slide. These are the genuine sources and adulterants. I gave some examples. Gum of Gugulu is adulterated with gum of Shellaki, and Arimeda with Aragvada, and Kupilu with Kataka, Manjishta with Kirata Tikta, Patranga with Rakta Chandana, Kampilaka with Ishtika Churna, Estimadu with Kunja Mula, Pipali with Chavya, Maricha with Erenda Karkati, that is papaya. Next one. Disadvantages of adulterants. Adulterants may cause death of patients. They may cause adverse reactions and side effects in patients. They lead to increase in price of product. Adulteration leads to damage of containers also, which may further development of moisture contents, etc. They cause to increase formulation, price of drug. Next one. Adulteration causes denaturation and degradation of the product, which may lead to the deterioration of the product and may cause artificial scarcity of a drug that leads to damage of dosage form. Adulteration leads to altering of the drug nature. Next slide. In conclusion, that I can say that crude drug or the food substances which we are taking should be tested properly, and we should take, because the harmful effects are more, where the good is very less and bad contents are more. So crude drug adulteration has to be developed as a major area of study, because it's high time to have a control over the malpractices. WHO in its publication on quality standards for medicinal plant materials, which recommends the rejecting any batch of raw material which has more than 5% of any other plant part of the same plant, nevertheless, if they are derived from the authentic plant. All these are possible measures like pharmacognostical study and phytochemical analysis to check adulteration in crude drugs should be encouraged. The collectors and traders have to be educated about the dangers and unethical nature of adulteration. Also, they should be educated about the authentic sources. The increased gap between the demand and supply should be reduced, as the demand is high and the production of raw materials is comparatively low. This problem can be resolved by promoting cultivation and conservation of natural resources, where we need more healthy. Yeah, thank you.
Thank you, Dr. Sai Pravalika. So next I invite Dr. Priyanka Shankar.
Yes, ma'am. Dr. Priyanka Shankar Dhodade. Hello.
Yes,
Hello,
doctor. You're
doctor.
audible.
Am I audible, ma'am?
Yes, Doctor Audible. Please share the screen, doctor.
Yes, yes.
Your screen is visible, doctor. Please start the session.
Good evening, all. My name is Dr. Priyanka Dhodade, and my guide name is Tushar Firke. And my topic is the review of migraine, that is Ardhaveda as Ayurveda and its Ayurvedic management. So what is migraine? Migraine is a primary headache disorder, and which is characterized by recurrent headache, moderate to severe pain, felt as a throbbing pain. And in this pain, one half of the head pulsating in nature for 2 to 72 hours. Associated symptoms: headache along with nausea, fatigue, mood changes, and increased sensitivity to light and sound. As we can see in the picture, up to 1/3 of people have an aura. Aura is a short period of visual disturbance. I will discuss later. History. Early description is found written around 1500 BC in ancient Egypt. The word migraine is a form in the Greek hemicrania, that is pain on the side of the head. Hemi is a head and cranium is a skull. So epidemiology, it is the 6th most disabling disease in the world, and it affects 1 person in 10. So 50% affect worldwide, and it is more common in women at 19% than men at 11%. And it most often start at puberty and worse during middle age. In some women, it is less common following menopause, and frequency of headache reduces after 50 years of age. So a main scenario, or we can say sign and symptoms. So 35 years old female patient coming to your clinic complaining of recurrent attacks of severe headache over the last 4 months. She describes the headache unilateral, then pulsating pain that lasts more than 5 to 6 hours. The attacks are accompanied by nausea, sometimes vomiting. And during the attack, she likes to sit in a dark room, and she can't make any activity, and anger is present there. So if a patient coming to your clinic with a complaint of headache, then what will make you suspect that it could be a migraine? So criteria of suggestion, the patient mostly female. So between 20 to 50 years, the headache unilateral, pulsating, as I said, long lasting, inhibiting or prohibiting daily activity. Then association, aura symptoms, vomiting, photophobia and phonophobia. Then be careful if the migraine is not only a headache. Sometimes migraine is present with other symptoms like unilateral weakness or vertigo. As we said, positional vertigo is also present there, or impaired visual symptoms, confusion, or sometimes abdominal pain also. So phases of migraine. There are 4 phases, and not all phases are necessarily experienced by the patient. So the prodrome phase, aura, then pain phase and postdrome. So prodrome occurs hours or days before the headache, aura, which immediately precedes the headache, and pain, also known as a headache phase, and postdrome, the effect experiencing following the end of the migraine attacks. So prodrome phase, 60% of those with migraines having a prodrome phase 2 hours to 2 days before pain or the aura. Okay, and symptoms may include altered mood, irritability, depression, or euphoria, fatigue, craving for certain foods, and stiff muscles, especially in the back of the neck. Then constipation or diarrhea, sensitivity to smells or noise, that is photophobia and phonophobia. Then aura phase. This is the main phase. Aura is a transient focal neurological phenomena, occurs before or during headache, appears gradually, starts over a number of minutes and lasts less than 60 minutes. Symptoms, visual, sensory and motor in nature, as we see in the diagram. Vision, scotoma or hemianopia occurs in up to 99% of cases. We can see the scotoma. Patient's vision is like this. Then hemianopia, vision is like this. Pain phase, headache, unilateral probing and as I said, then comes on gradually aggravated by physical activity. Then bilateral pain is 40% of cases. Neck pain is common and pain lasts 4 to 72 hours in adult. Then pain accompanied by nausea, vomiting, sensitivity, then sound, smells, fatigue and irritability. Other symptoms, blurred vision, then diarrhea, frequent urination is also present here, and pallor and sweating. Then diagnosis. What is the diagnosis criteria? According to International Headache Society, the 5-4-3-2-1 criteria, 5 or more attacks, then 4 hours to 3 days in duration, that is 4. Then 2 or more of the following are unilateral, then pulsating and moderate or severe pain intensity. Then worsen by or causing avoidance of routine physical activity, 1 or more of the following, that is nausea, vomiting, or sensitivity to both light and sound. Then differential diagnosis. As we can see, there is a sinus. In sinus, pain is behind brow bone and or cheekbones, as we see in the diagram. Then cluster pain. Pain is in and around one eye. The tension. Pain is like a band squeezing the head. Then migraine, pain, nausea, vomiting. Then visual changes are typical of classic form. Some unusual form of migraine, hemiplegic migraine or retinal migraine, basilar migraine, migrainous stupor, ophthalmoplegic migraine or migraine equivalent, menstrual migraine, and status migrainosus. Then migraine equivalents. A migraine equivalents may be characterized by visual symptoms such as blind spots or partial vision, neurological defects, or psychic disturbance without a headache. Without headache, it is easier to diagnose if these symptoms had previously accompanied by attack associated with headache, but often the elderly develop the visual symptoms for the first time without head pain. Migraine equivalence is mainly physic disturbance is there without a headache. So we can differentiate. Ophthalmoplegic migraine. Ophthalmoplegic migraine is a very rare type of migraine, occurs mainly in a young people, and symptoms will be due to the weakness of 1 or more of the muscle that move the eye. Symptoms include dilation of the pupil, inability to move the eye upward, downward, or across, as well as drooping of the upper eyelid together with a headache. Then vestibular migraine. It should be suspected if there is a history and or family history of migraine, history of recurrent bouts of spontaneous vertigo. Then vertigo takes the place of the aura that precedes the headache or maybe a migraine equivalent, whereby vertigo replaces the symptoms of headache. Nausea, vomiting may be present. Retinal migraine. Migraine may be present with symptoms of visual loss. Associated headache and nausea may not be present. Clinical features, zigzag lines or lights, then multicolored flashing lights patient may see, unilateral or bilateral filt, and resolution with a few hours. Then menstrual migraine, a specific condition where the timing of attacks is limited to the menstrual cycle. There is no aura or it can last longer than other types and affect fewer than 10% of women. The two most accepted theories of the causes are withdrawal of estrogen as a part of the normal menstrual cycle. As we know, release of prostaglandin during the first 48 hours of menstruation. Prevention. It includes medications and nutrition, supplements, lifestyle alternations, and surgery. The goal, reduce the frequency, painfulness, duration of migraine, and to increase the effectiveness of abortive therapy. The treatment of acute attacks. Commonest treatment at the earliest impending sign, mild headache may require no more than conventional treatment and a go lie down in a quite dark room, rest in a quite darkened cool room, then place cold pats on the forehead or back of the neck. Avoid drinking coffee, tea, or orange juice. Avoid moving around too much. Do not read or watch television. For patients who find relief from simply sleeping off an attack, consider prescribing diazepam in addition to the medication. For moderate attack, use of oral ergotamine. Then medication options, aspirin or paracetamol. Paracetamol or ibuprofen, that is NSAIDs. Then used in moderate to several attacks, ergotamine in case of severe attacks. In nausea and vomiting is a feature, then we can use this treatment. Then in Ayurveda, we can relate the migraine with Ardhaveda. So Ardhaveda causes suppression of natural urges, indigestion, intake of dry food, then oily and spicy food, exposure to sunshine for prolonged period, for or cold fasting, anger, jealousy, grief, stress, etc. Intake of dry, pungent, and salty food, etc. According to Charaka and Madhavacharya, Ardhaveda is a Vat or Vat Kafaj Vadhi. According to Sushruta, this is three doshas. And according to Ashtanga Hriday, Ardhaveda is a Vataj Vadhi. So treatment in Ayurveda, there are so many treatments for Ardhaveda or Ulva Jatrugat Vadhi. Like Abhyanga, Snehapana, Nasya, Lepa, Parisheka, Shirobasti, Dhumapan, Raktamokshana, Agnikarma over Bru and Lalat. Nasya, Aupida Nasya, Apamarga Moolam or Bal Moola, triturated in water, Nasya with stirrer rasa, then Vamshi Moola, Vacha or Pipli, then Vamshamula, Karpura or with a honey, and Yashti with a honey or Chandan and honey or Ajakshira, then Kakoladi Grita, Murvadi Grita, Kshirbala Tailam, Dhanvantari Tailam or Anutel. Anutel is best for Ardhaveda, then Shadbindu Taila, then Lepa on forehead with a prapunda mixed with a amla dravya. Then drug specified pitta dosha like chandan, karpura or jatamansi. Shirodhara, Kshirbala Taila, Chandanadi Taila, and Vata involvement is high. Kshiradhara, that is cow milk, Kshirdhara with cow milk, is done when Pitta involvement is more. Then Takradhara, that is buttermilk, is done when there is Vata involvement. Then internal medicine, Pathyadi Kvatha, used in a treatment of headache, earache, or pain in a temporal region. Then Shilshuladi Vajraras, used in a Ayurvedic treatment of headache, migraine, then tension, headache, vascular headache, etc. Then Mayura Grita, Bhunimbadi Kwath, used in fever, cold, and sinusitis, headache. Then Godanti Bhasma, 250 mg of this medicine is given twice a day. In many occasions, it gives immediate relief from migraine within 20 to 30 minutes and much faster than paracetamol. And we can for Urdhva Jatrugat Vadi or for Ardha Vedak, or we can do the daily activities as a yoga or meditation is also very useful in Urdhva Jatrugat Vadi. Thank you.
Thank you, doctor. Thank you for the wonderful presentation.
Thank you, sir.
Next, I invite Dr. Abhijit Ganesh Mayane for the paper presentation. Dr. Abhijit Ganesh Mayane, are you there? Dr. Supriya Vijayrao for the presentation. Dr. Supriya Vijayrao Salunkhe, are you there? Dr. Supriya Vijayrao Salunkhe, are you there? Okay, next I invite Dr. Sheikh Praveen for the paper presentation. Dr. Sheikh Praveen, are you there? Dr. Sheikh Praveen, are you there? Okay, next I invite Dr. Megha Titke for the paper presentation. Dr. Megha Titke, are you there? Dr. Megha Titke, are you there? Next I invite Dr. Shamli Hiware for the paper presentation. Dr. Shamli Hiware, are you there? Dr. Shamli Hiware, are you there? Okay, we are come up to the end of the session. I would like to invite our presentation coordinator, Dr. Aishwarya RS, to conclude the session. Hello, Dr. Aishwarya.
Thank you, Dr. Sabin. So it's an official end of our second session of Karmanya National Seminar. And before going to be in, at this occasion, I would like to express my sincere gratitude for our respected panel members. And once again, I take this opportunity to congratulate all our participants for their energetic performance. And there will be one more session will happen on 17th, and we'll hope for the best. I wish all the very best for the upcoming participants, and thank you all. We'll meet you soon.